The following program includes graphic images and mature subject matter intended for adult audiences. Viewer discretion is advised.
On the street, it's known as smack, skag, or simply junk. But most just know it as heroin, a drug that's so addictive, once you're hooked, getting off can be near impossible. That's why some doctors say when nothing else works, we should be prescribing hardcore addicts the very drug they're hooked on, heroin. It might seem crazy, but it works in Europe. And for the first time, it's about to happen in Canada, even though the federal government is fighting it all the way. And a warning, some of the images you're about to see may be disturbing.
Oh, here it is.
It's morning in Vancouver's downtown east side, and Kevin and a friend are cooking up their first injection.
Yeah.
And we should be using a filter, but I'm too lazy sometimes. I just want to get it in me quick.
The ritual of the fix requires a few simple tools, 1/10 of a gram of powder, and the need that never goes away.
There you go. Hey, here, come here. Yeah.
There's no better feeling in the world.
There isn't. Nothing.
It's warm and relaxing.
It's like Grandma giving you a big warm hug and never letting go.
A rock of heroin worth $70 on the street, precisely measured, is just enough for one day's escape.
If I could feel like that 24/7, I'd be in my glory for sure.
Kevin has used up most of his veins. Sometimes he'll inject in his foot, but today he's muscling it in what's left of his arm after a car crash.
That's called an intramuscular shot. Intramuscular shot instead of an IV shot, because my veins are done.
He has about 3 minutes before the rush begins. Time enough to clean up.
I mean, that's my sharp box. You know what I mean? And I've emptied it once this year, and it's half full again.
Soon, Kevin slips into a chemical calm and forgets we're there. The escape, however, is brief. In a few hours, the cycle will begin all over again. It's called life at the end of a needle, squalid and dangerous. But it doesn't have to be this way.
Hey, Daryl. Good, how are you? Good.
Brent Olson needs his daily injections too, but all he has to do is visit this clinic 3 times a day. There's no cost, no stress.
It has saved my life up to this point. I can't guarantee that that this drug will destroy or kill my life. All I can say today, it's helping keep me alive.
How did it save your life?
Well, getting me to appointments, the doctors, the nurses, the staff, everything. Without them, I don't think I'd be sitting here right now. Or I'd be in jail. Or I'd be dead from doing street drugs, street heroin.
Brent is one of 120 addicts whose doctors say they don't respond to the traditional treatment. So next week, the first group of addicts will begin taking heroin for their addiction. Until then, Brent and the others are using a substitute drug.
Thanks very much, Joe.
When they switch to heroin, that first group will make medical history. The drug has never before been issued outside a clinical trial in North America.
This is a superior treatment.
Dr. Scott McDonald is one of the doctors who will prescribe the heroin. He says it's the last resort for his patients.
They had tried and treatment had not worked for them 11 times.
What sort of treatment are we talking about?
We're talking attempts at methadone, detox, and other treatments, including residential treatment.
I could get you a sign there. Sure.
McDonald works for Providence Healthcare, a Catholic society that's paying for the first shipment of heroin. It says the social and economic benefits of the prescription heroin program are substantial, and they have numbers to back it up. Providence calculates it costs $27,000 a year to keep one addict in a prescription heroin program. But on the street, that addict costs society more than $45,000 in crime and emergency care. That's a savings of at least $18,000 per addict per year. Applied to all hardcore heroin addicts in Canada, the savings to taxpayers could be as much as $150 million a year, enough to pay for 1,500 new ambulances.
My first joint was 19 years old. Cocaine, my mid-20s, and then heroin in my mid-30s.
Brent hit rock bottom after a promising hockey career was cut short by injury. Soon, he was shooting up every day.
What was your life like?
I was stealing every day to make my 20, 30 bucks I'd have to make that, just to feel normal.
Stealing what?
Anything I could get out of a store without getting caught.
Feeding your addiction?
Feeding my addiction.
At one point, was there anything you would have done for heroin?
Yes.
What's the worst thing?
Stealing from my mother. Okay, we're done. That's it.
There's the shame and there's the crime, and there's also the pervasive fear of what street heroin can do.
You never know what you're receiving in illicit heroin. It can be adulterated with other compounds. It can be dirty and unclean. We regularly have overdoses here in Vancouver because of those substituted compounds.
Sure enough, only days after that interview, a flurry of overdoses in Vancouver, and at least one death that could have been prevented.
We advocate for the human rights of people who use opiates.
Addicts say freedom from fear is one of those rights, a theme you hear over and over again at weekly meetings of people waiting for the pharmaceutical heroin. They allowed 16 by 9 to film, although most didn't want their faces shown.
Do you guys know anybody that smokes heroin? To be very, very careful of that fentanyl stuff.
Yes.
It burns your lungs out. My son died 2 weeks ago because of it.
One more reason these addicts are so impatient for the pharmaceutical heroin injections to begin.
We haven't started yet. It keeps getting pushed back. It was October, and this is October now. And then it went to November, and then December.
But if the Harper government had its way, the injections they're waiting for would never start at all. Next, a controversial prescription.
That drug that ruined my life possibly saved my life right now.
Come on, guys. Everybody's going to get in, so let's not push the guy in the wheelchair, okay?
They call Dean Wilson the mayor of the downtown east side.
This is the epicenter right here of probably the open drug market.
A one-time heroin user who now spends his day helping other addicts.
Okay, next. What we try to do is to keep people healthy enough and live long enough to make the right decisions.
Vancouver already gets international attention for its progressive approach to drug addiction. There's the controversial safe injection site called Insight, which won the right to continue operating after a legal fight with Ottawa.
Hey, bud. Hey, what do you need? All of it. Drinks and waters? Okay, there you go.
Addicts also have 24-hour access to free injection supplies, including the so-called safe hit kit, syringe, needles, tourniquet, cooker, and sterile water. Advocates say prescribing some addicts heroin is the next natural step.
It's a matter of trying to get everybody into our way of thinking, I guess.
But Dean's way of thinking about heroin treatment has set off alarm bells in Ottawa. Health Minister Rona Ambrose, for one, is dead set against the idea of giving heroin to hardcore addicts. Here's Ambrose last year.
The Prime Minister and I do not believe we are serving the best interests of those addicted to drugs and those who need our help the most by giving them the very drugs they are addicted to.
So Ambrose played the spoiler. Until a year ago, Health Canada allowed doctors to prescribe heroin to certain patients. But in October 2013, Ambrose changed the rules and banned the prescribing of drugs such as heroin and cocaine. And that infuriates addicts like Brent Olson.
Have you ever had anybody in your family addicted to heroin? What if treatment doesn't work for them? Then where do they stand? What would you say to them now, Mr. Politician?
So you're saying this is an absolute last line of defense?
This is our last line of defense.
And if we didn't use that last line of defense, what would happen?
You're going to have addicts who are going to steal, rob, pass disease, fuel the prostitution until the day they die.
And the BC Supreme Court agreed. Last May, a judge ruled that a group of addicts should get temporary access to the drug. The judge said that potential harms are grave if they didn't get the heroin they needed. That opened the way for 120 addicts, including Brent, to get on the list for legal heroin.
Is this life and death, do you think, for some people?
Sure it is. Sure it is.
Have you seen people die from heroin overdoses?
I have. I've had a couple of close friends in the last year die of a heroin overdose.
Brent will be watching closely when the whole issue is revisited in court next year, with lawyers arguing that he and other addicts should have full access to prescription heroin under the Charter of Rights and Freedoms. Meanwhile, Ambrose wouldn't talk to 16 by 9 about the story, but one of her strongest supporters did.
It's always interesting being back down here.
Marshall Smith is a recovered addict who works at an addiction center on Vancouver Island and still remembers his years in the alleys.
Yeah, I know what addiction's about. Yeah, I've been there. When the pain of continuing begins to outweigh the pain of stopping, then recovery can start.
You make it sound like it was just a matter of choice.
It was a matter of choice. I was tired of being cold. I was tired of being on the streets. I was tired of being chased around by the police. And I was tired of getting high all the time.
So Marshall left the alleys and went into a traditional recovery program, one designed to wean addicts off drugs. He says the route he took could help most addicts.
They need to be removed from the environment where there's drug using going on constantly around them. It's very difficult, impossible almost, for people to make rational decisions around their own health care while their brain is chemically hijacked by these chemicals.
So you're saying there are better treatment options out there other than prescription heroin?
Addiction is a highly treatable, highly survivable brain disorder. People get clean and sober and enter recovery every day in this country, right? By the thousands.
In Europe, however, prescription heroin is the new way. 5 European countries, the UK, Denmark, Germany, the Netherlands, and Switzerland, now have heroin programs in place. In the mid-90s, scenes like this shocked the Swiss public, and the government said, enough. Last year, the Swiss program treated 1,600 addicts in 22 clinics, including one clinic in a prison. Since the program started, doctors have reported a sharp drop in overdose deaths. 8 clinical studies support the view that prescription heroin is the best treatment for those 10 to 15% of heroin addicts who aren't helped by methadone or other treatments.
And it's just phenomenal how much they change once we get our hands on them.
Dean Wilson visited one of those European programs and came away impressed.
We found that in Germany, when they did it, that 40% of the people in the beginning on the heroin program were homeless. At the end of the program, none were. We had 25% actually find employment, something that none of them had done any time in their life. The transformation is amazing.
But Brent Olson isn't expecting an amazing transformation. After a lifetime of addiction, he's so damaged that even collecting empty cans is a struggle. All he wants now is the prescription, he says, will make his life a little more bearable.
How do you feel about the fact that you've applied to the government for access to the very drug that ruins your life?
That drug that ruined my life possibly saved my life right now.
But if it weren't for the heroin, you wouldn't be here in the first place. Can you see the logic in that, Brent?
No. It's a trade-off, I guess.
Between?
Wanting to live and just wanting to exist.
Which one do you want more?
Well, I want to live.
Just enough for one day's escape.
If I could feel like that 24/7, I'd be in my glory for sure.
Kevin has used up most of his veins. Sometimes he'll inject in his foot, but today he's muscling it in what's left of his arm after a car crash.
That's called an intramuscular shot. Intramuscular shot instead of an IV shot, because my veins are... Oh, here it is.
It's morning in Vancouver's downtown east side, and Kevin and a friend are cooking up their first injection.
Yeah.
And we should be using a filter, but I'm too lazy sometimes. I just want to get it in me quick.
The ritual of the fix requires a few simple tools. 1/10 of a gram. The following program includes graphic images and mature subject matter intended for adult audiences. Viewer discretion is advised.
On the street, it's known as smack, skag, or simply junk. But most just know it as heroin, a drug that's so addictive, once you're hooked, getting off can be near impossible. That's why some doctors say when nothing else works, we should be prescribing hardcore addicts the very drug they're hooked on, heroin. It might seem crazy, but it works in Europe. And for the first time, it's about to happen in Canada, even though the federal government is fighting it all the way. And a warning, some of the images you're about to see may be disturbing.
Of powder and the need that never goes away.
There you go. Hey, here, come here. Yeah.
There's no better feeling in the world.
There isn't. Nothing.
It's warm and relaxing.
It's like grandma giving you a big warm hug and never letting go.
A rock of heroin worth $70 on the street, precisely measured,